A New Sociology of Health and Illness by David Williams is a pivotal exploration of health and illness through the lens of sociology. It addresses how social structures, cultural dynamics, and inequalities influence health outcomes and medical practices, positioning itself within a sociological framework that challenges traditional biomedical models of health. David Williams' work contributes to a growing body of literature that underscores the role of societal factors in shaping health, particularly in an increasingly globalized and unequal world. Introduction to Sociology of Health and Illness. Sociology of Health and Illness examines the ways in which social, economic, and political forces impact individuals' health experiences and medical systems. Traditionally, health has been viewed through a biomedical lens, focusing primarily on biological explanations for diseases. However, the sociological perspective broadens this view by emphasizing that health is socially constructed, determined by various non-medical factors such as socioeconomic status, race, gender, environment, and lifestyle. David Williams builds on classical sociological ideas to provide a contemporary and interdisciplinary understanding of health. He challenges the dominant biomedical paradigm and introduces a framework that prioritizes structural determinants of health. For Williams, health is not merely the absence of disease. It is influenced by a wide array of societal factors that operate within larger systems of power and inequality. Theoretical framework. In A New Sociology of Health and Illness, Williams integrates sociological theories to explain how health disparities arise and persist in modern societies. He draws upon the works of classical sociologists like Emil Durkheim, Karl Marx, and Max Weber, who laid the foundations for understanding social systems and inequalities. 1. Durkheim and social integration. Durkheim's theory of social integration provides an important starting point for Williams. Durkheim argued that the level of social connectedness affects individual well-being. Williams applies this idea to health outcomes, asserting that social isolation or exclusion leads to increased risks of illness and mortality. People who lack support systems may have limited access to health care, are more vulnerable to stress, and often engage in unhealthy behaviors. To Marx and social inequalities. Building on Marx's theories, Williams highlights the role of socioeconomic inequality in health. He argues that capitalist systems prioritize profit over human well-being, which disproportionately affects marginalized communities. For instance, low-income populations face greater environmental hazards, limited access to health care, poor working conditions, and higher exposure to stressors. These factors collectively contribute to poorer health outcomes. 3. Weber and bureaucracy. Williams also references Weber's work on bureaucracy and rationalization. He critiques how modern healthcare systems, though designed for efficiency, often alienate patients by treating them as mere cases rather than individuals. Additionally, the medicalization of health issues reflects how professionalized medicine exerts social control, defining what counts as normal and pathological. By synthesizing these sociological perspectives, Williams constructs a holistic view of health that moves beyond individual choices and biology to address the structural and institutional determinants of health and illness. Social determinants of health. Central to Williams' work is the concept of social determinants of health, the economic and social conditions that influence individual and group health outcomes. These determinants are embedded in societal systems and include factors such as income, education, employment, housing, and discrimination. 1. Income and class. Williams discusses how socioeconomic status, SES, is a primary determinant of health. Lower income individuals often experience poorer health outcomes due to lack of access to quality health care, nutritious food, and safe living environments. The social gradient in health indicates that as social and economic conditions worsen, health declines. 2. Race and ethnicity. Racial disparities in health are another key focus. Williams explores how racism, both structural and interpersonal, affects health outcomes. Minority populations often face discrimination within healthcare systems, experience higher rates of chronic diseases, and live in underserved communities with limited resources. 3. Gender. Gender is also explored as a determinant of health. Williams highlights the unique health challenges faced by women, particularly related to reproductive health, domestic labor burdens, and gender-based violence. At the same time, he acknowledges the ways traditional gender roles impact men, leading to higher rates of risk-taking behavior and underutilization of healthcare services. Environment. Environmental factors, including pollution, urbanization, and climate change, significantly impact health. Marginalized communities are often exposed to hazardous environments, such as industrial waste or unsafe housing, which increases their risk of respiratory illnesses, cancers, and other diseases. 5. Access to healthcare. In A New Sociology of Health and Illness, Williams critiques the unequal distribution of healthcare services. Even in wealthy nations, healthcare systems often fail to address the needs of the most vulnerable populations. Issues such as privatization, lack of insurance, and systemic discrimination further exacerbate health inequalities. Medicalization and social construction of illness. One of Williams' key arguments revolves around the medicalization of life experiences. Medicalization refers to the process by which non-medical problems are defined and treated as medical issues. For example, behaviors like hyperactivity or sadness are increasingly diagnosed as medical disorders, often leading to pharmaceutical interventions. Williams critiques the ways medicalization expands medical authority and reduces complex social problems to individual pathology. This shift diverts attention from structural issues like poverty or stress that contribute to health problems. The social construction of illness, as Williams argues, highlights that definitions of disease are influenced by cultural norms, power dynamics, and historical contexts. Global health inequalities. In an interconnected world, Williams examines how globalization has intensified health disparities between the global north and global south. Developed countries enjoy advanced healthcare systems, while developing nations often face severe challenges, including infectious diseases, lack of infrastructure, and poverty. Furthermore, Williams criticizes how multinational corporations exploit resources in poorer nations, exacerbating environmental and health crises. The unequal distribution of vaccines, treatments, and healthcare technologies reflects global hierarchies of power. Williams emphasizes the need for international cooperation and ethical policies to address these inequalities and promote global equity. Critique of biomedical model. While recognizing the importance of biomedical advancements, Williams critiques the limitations of the biomedical model. This model, which dominates modern healthcare, focuses on treating diseases as purely biological phenomena. However, it often neglects the social and psychological dimensions of illness. For instance, a doctor may prescribe medication for hypertension without addressing the patient's stressful working conditions or socioeconomic struggles. Williams argues for a more integrated approach that combines biomedical solutions with social interventions. Addressing the root causes of illness, poverty, inequality, discrimination, and environmental hazards requires a shift in priorities from treatment to prevention. In A New Sociology of Health and Illness, David Williams advocates for a transformative approach to health that centers on social justice and equity. By situating health within broader societal contexts, Williams provides a compelling argument for addressing structural determinants of health. To achieve better health outcomes, policymakers, healthcare providers, and societies must recognize that health is not solely a personal issue, but a collective responsibility. Reducing health inequalities requires systemic changes, tackling poverty, improving education, ensuring equitable access to healthcare, and challenging discriminatory practices. Williams' work serves as a call to action for both scholars and practitioners to move beyond the biomedical paradigm and embrace a holistic understanding of health. In doing so, his New Sociology of Health and Illness equips us to address the deep-seated inequalities that shape health experiences in the modern world.